Have you ever heard the word thrombosis and wondered what it really means? It sounds a bit scary, right? Well, thrombosis is when a blood clot forms inside your veins or arteries, blocking the normal flow of blood. This might seem simple, but it can be incredibly dangerous if it's not caught in time. In this video, we're going to break down what thrombosis is, why it happens, the warning signs you should never, ever ignore, and how it can be treated and prevented. So, please stay with us until the end, because this information could literally save a life. Every single second, your blood flows through this amazing network of veins and arteries, carrying vital oxygen and nutrients to every part of your body. Now, when you get a cut or an injury, your blood naturally clots to stop the bleeding. That's a good thing, a healing thing. But sometimes, a clot can form when there's no injury at all. This unwanted clot can block blood flow, leading to serious, life-altering problems like a heart attack, a stroke, or a condition known as deep vein thrombosis. There are two main types of thrombosis: venous and arterial. Venous thrombosis is when a clot forms in a vein, most often in the legs. You've probably heard of deep vein thrombosis, or DVT. That's when a clot develops deep inside your leg. The real danger here is if that clot breaks free and travels to your lungs. This causes a pulmonary embolism, which is a medical emergency that can be fatal. Then, there's arterial thrombosis. This happens in an artery, one of those vessels carrying oxygen-rich blood from your heart to the rest of your body. This type can lead to heart attacks or strokes because it cuts off the blood supply to your vital organs. So, what actually causes these clots to form in the first place? Well, there are several risk factors. Sitting for long periods, like on a long flight or at your desk all day, can really slow down the blood flow in your legs. Dehydration is another big one. It thickens your blood and increases the risk of a clot. Smoking is terrible for your blood vessels. It damages their walls and makes clots much more likely to form. Certain medical conditions like obesity, diabetes, or even cancer can also raise your risk. Hormonal changes, like during pregnancy or when using birth control pills, can also play a role. And for our seniors, slower circulation and being less mobile naturally make thrombosis more common. So, how can you tell if you might have a blood clot? The symptoms really depend on where the clot is. If it's in your leg, you might notice swelling, a feeling of warmth, redness, or pain, especially in your calf. Your leg might feel tight or heavy. But if a clot has traveled to your lungs, the signs are different and much more urgent. You might feel short of breath, have chest pain that gets worse when you breathe deeply, a racing heartbeat, or even start coughing up blood. These are serious, critical warning signs that need immediate medical attention. Please, don't try to wait them out. Go to the hospital right away. When doctors suspect thrombosis, they usually start with tests like an ultrasound of the leg veins, blood tests to check for clotting factors, or imaging scans to find any blockage. Once it's diagnosed, the main goal is to stop the clot from getting bigger and to prevent new ones from forming. The most common treatment is medication called anticoagulants, which you might know as blood thinners. These drugs don't actually thin your blood. They just make it less likely to clot. Common examples are heparin, warfarin, and newer drugs like apixaban or rivaroxaban. In more severe cases, doctors might use stronger medications called thrombolytics. These can dissolve existing clots very quickly, but they're usually reserved for life-threatening situations because they carry a higher risk of bleeding. Sometimes, doctors might also place a tiny filter in a large vein called the vena cava. This little device acts like a net, catching clots before they can reach the lungs. And if the thrombosis is caused by an underlying issue, like varicose veins, a heart condition, or cancer, treating that root cause is an absolutely vital part of the recovery. Lifestyle changes also play a huge role in both treatment and prevention. Staying active is one of the best things you can do. If you sit for long periods, try to get up, walk, or just stretch your legs every hour. Staying hydrated keeps your blood flowing smoothly, so keep that water bottle handy. If you smoke, quitting is one of the most powerful changes you can make. And maintaining a healthy weight through balanced eating makes a massive difference. Foods rich in omega-3s, like fish, flax seeds, and walnuts, are great for keeping your blood vessels healthy. And please, if your doctor has prescribed medication, take it exactly as directed. Skipping doses can be very dangerous. Many people recover from thrombosis and go on to live full, healthy lives. The absolute key is early detection and consistent care. Knowing the symptoms and acting fast can make all the difference in the world. So if you ever notice swelling, redness, or unexplained pain in your leg, please don't ignore it. It might seem small, but it could be your body's way of telling you it needs help. In short, thrombosis isn't something to live in fear of, but it is something to respect. It's a signal to take your circulation and movement seriously. With awareness, prevention, and modern treatments, thrombosis can be managed effectively. If you found this video helpful, please hit that like button and share it with your friends and family. You never know, it might help someone catch those warning signs early. And don't forget to subscribe to our channel for more simple, science-backed health tips to help you live a stronger, healthier life. Stay active, stay aware, and take care of your heart and blood vessels. They're working hard for you every single second of every single day. Thanks for watching.